2009, Hines Ward, one of the greatest receivers the NFL's ever seen, sprained his medial collateral ligament in the championship game, and he almost had to sit out of the Super Bowl. Instead, though, he went and got platelet-rich plasma injections into that ligament, and not only rejoined the Steelers for the Super Bowl, but he helped him win the game that year. So today I'm going to talk to you about sports injuries and why a platelet-rich plasma injection might be a good treatment option for you. First off, it's important to understand that soft tissue injuries are fairly common in competitive sports. Things like a knee sprain or strain from a stop-twist injury, like is common in basketball, football, and soccer. Rotator cuff injuries are fairly common in sports that use a lot of overhead motions, like baseball pitchers or swimmers who do the breaststroke. Runners tend to develop Achilles tendonitis, and we've all heard of golfer's elbow, where you develop a tendonitis in the elbow from that repetitive swing motion. These injuries can take weeks to heal, even with aggressive physical therapy, and they often sideline an athlete for the rest of the season. So that's why your favorite athletes like Alex Rodriguez, Brandon Roy, Tiger Woods, and Hines Ward have all opted to do platelet-rich plasma injections. So what is a platelet-rich plasma injection? Well, it is an injection of platelet-rich plasma, which we develop by collecting the patient's own blood. It is then spun down in a centrifuge just like this, and we end up with a sample where all the components of the blood have been separated. So down here you have your red and white blood cells. At the very top you have platelet-poor plasma, and then down here in this little patch we have what's called platelet-rich plasma. This platelet-rich plasma is separated out, the rest is discarded, and now it can be injected directly into the site of injury. So why does it work? Well, your platelets are your aggregators. They're the first cells that arrive at the site of an injury, and they really kickstart that healing process. Your platelets are an integral part of cell recruitment, multiplication, and specialization. So they gather other local cells nearby, they tell those cells what to do and how to do it to start rebuilding healthy tissue. Your platelet-rich plasma is also rich in proteins, cytokines, and growth factors. So why doesn't your body do it naturally? Well, the truth is that it is doing it, but it's just doing it at a much slower rate. So the platelets are circulating through your blood all the time. They come across an injury and they start that healing process. When we collect the blood and we spin it down, we end up with a sample that is 5 to 10 times more potent than what's naturally occurring in your bloodstream. The act of injecting it activates those platelets. So now they're on high alert. They're ready to do some work. And then we're concentrating that action directly into the site of the injury to really kickstart that healing process for you. This can shorten the duration of an injury by weeks, and some patients even find that they end up feeling better than they did before the original injury. So if you've had a sports injury or really any other soft tissue injury, give us a call or come in, let us evaluate you and see if you might be a good candidate for a platelet-rich plasma injection. Have a good day, guys.